I just want to open this meeting by welcoming you to the African American Cultural Society and sharing with you our concerns and our response to those concerns around the coronavirus and the distribution of the vaccines that are available. So at AACS, in response to the overwhelming impacts of the COVID pandemic on communities of color, and an acknowledgement of the hesitancy with which our people and people of color generally are approaching the available vaccines and the concerns they have about the virus and its mutations, AACS, African American Cultural Society, proposes to serve as an information resource for its membership as well as for the greater community in Palm Coast and neighboring counties. To that end, we are partnering with the Flagler Department of Health, our president, Joe Matthews, our membership, including some of our board of directors, others in the medical community that, quite frankly, look like us, that can address some of our concerns. So we've asked this initial group to weigh in with your questions to Bob Snyder and Dr. Bickel at Department of Health. And perhaps those questions, if you pose them, can be answered. And as our community sees these forums, and we intend to do this monthly for the foreseeable future, until we see an uptick in the numbers of people in our community that are actually accessing the vaccine. So we invite you to ask those questions. And I'm remembering from school, there are no silly questions. There are no stupid questions. Right now, we need every question that you can imagine to throw at our health department and to throw at our professionals so that we can encourage our community members and our membership to access the vaccine, or at least to put the information where they can get it so they can make an informed decision. So I want to welcome all of you today, and I'd like to have a word from our president, Joe Matthews, and then the Department of Health will join us and we'll start to ask our questions. Joe, can I bring you in for a moment?
Yes, thank you, Sybil. And I want to thank all of you that are on the call today. I'm very, very much concerned, as the health professionals and scientists are, that we're not getting the vaccine to people of color. And there is that hesitancy to take the vaccine. So I want these sessions to be of informational and of a nature that will dispel the fears that they may have, whatever those fears are, a fear of needles or the hesitancy because of past history on the way African Americans have been treated in the past and people of color. So that's what I'm trying to get out of this session. I'm very, very passionate about having this information disseminated, and we have enough people who can answer any questions that might come about from the audience, which we're trying to hit. So fire away. Thank you, Bob and Dr. Bickel, for being on this panel.
Okay, thank you, Joe. And with that, Dr. Snyder, Bob Snyder, can we have you on?
Yes, you have me on, and Dr. Bickel is going to follow me. We did a informative PowerPoint presentation that to cover many of the topics that Sybil, Joe, and Dr. Robinson and I discussed, along with Blanche and others. So if you can pull up, who's going to be our PowerPoint organizer?
Michelle will be taking over that part of it. And I want to thank everyone who is participating today. and to let you know that as we move forward, there will be other voices and other folks who will be posing questions. And hopefully we'll get to a point where, we'll reach out beyond our community and get real information to our folks. So as soon as we're able, Michelle, to pull that up, we'll go forward. While we're waiting, just to fill a little time, Rob, one of the questions, Bob, that came to me today was, will multiple vaccines be necessary as we move forward?
Yeah, right now, we have three. We have the Pfizer, the Moderna, which are the 2-shot regimen, and then J&J. We received our very first shipment of the J&J 1-dose vaccine this week, and we received 800 of those. So right now there's 3, and we do expect there to be more. Merck is conjoining up with Moderna to manufacture the vaccines. That's the mRNA vaccine. And then AstraZeneca would be another company that we believe will be seeking FDA approval for emergency use authorization. And I believe there's a couple more in the pipeline. So there will be, at the end of the day here, more than just the 3 vaccine products that we have today. All right, well, let's begin, everyone. I'm Bob, and I'm the administrator of the health department, and Dr. Bickel, who's going to follow me, Steve, is the medical director of the health department, and it is absolutely our pleasure to be your guest presenters today. The first slide is data through midnight last night, March the 11th, and it basically shows the total number of positive cases in Flagler County. You see it up there in the top left, 6,201. And then below it, you see the gender breakout, the age range, the median age being 46. And then on the right-hand side, starting on February 25th, you get to see how many positive cases we've had per day over the last 14 days. A general comment is that over the last 3 weeks, we have seen a spike, an increase in cases. So we'll talk more about that as we go along further. The next slide shows the number of cases by race, ethnicity, and hospitalizations and deaths by those categories. And so let's look at our African-American population there. You see in the second bracket, African-Americans, 700 total cases. So that represents 11% of the total positive cases are of African Americans, which does equate to the percentage of African American population in total here in Flagler. But when you move over to the right, scan to that hospitalization column, and you see that it's not quite the same. 19% of hospitalizations due to COVID have been a result of people of color in our community. So there's a disparity there. And then 10% of total deaths. The next slide is something that Dr. Bickel and I track and look at on a daily basis. And here you have a weekly count of emergency room visits at Advent Health Palm Coast Hospital that are related to symptoms having to do with COVID, the COVID illness. So you all know what those symptoms are. It's a cough that's uncontrollable, fever, respiratory issues, all of those things. And when they present themselves, you can see here, starting on the week of January 24th through the week of January 31st. And you can see that for the whole month of February, we had a nice decline of COVID-like illnesses that arrive in the emergency room. But you can see what happened there the week of February the 21st through the 28th, and it continues. We see another little spike in emergency room visits related to COVID-like symptoms that invariably will lead to more hospitalizations. So that's why we are, concerned, and that's the reasons why we have seen an increase in the last 3 to 4 weeks of cases. This is a really important visual slide. It shows on the left-hand side, the lower axis, the beginning of March, and this is total positive cases by week. So you can see what happened there in the beginning. The governor and cities and counties put into place some restrictions. And then you can see what happened when those restrictions were lifted. You can see the big surge during the month of June and through July in the summer, kind of an up and down pattern here.
Wow.
But look at this during the holidays. When you see November and December, you can see the impact of that and the increase in cases. And then I just mentioned the recent spike that we were not expecting. And again, we'll talk more about that. I'd love Dr. Bickel to chime in on that when he does his presentation. He and I discussed this a lot as to the reasons why. Basically, we feel like people are not as careful as they had been, and COVID fatigue has set in. So we really want to continue to stress the importance of mask wearing still and social distancing. So here are some key indicators. I already mentioned to you the number of cases, 6,201 for Flagler County. By the way, just as a data point, total cases in the state of Florida is 1,962,000. In Flagler County, we've had 93 deaths attributed to COVID. You see 44,000 people, the next bullet, who have been tested for COVID, either through that PCR test or the Abbott rapid antigen test. Hospitalizations today related to COVID is 11. That is an improvement. It was in the 20s and 30s the last 2 weeks. So we've seen a downward trend. The emergency room visits for those COVID-like symptoms, they are trending upward, as I just shared. And here's the average weekly positive case average for the last 4 weeks. So on a daily basis, we averaged 40 positive cases, then 23 3 weeks ago, and then back up to 26. And then last week, 19. So it's up and down, up and down. The positivity rate, which we like to see below 1%, is right now at 8.6% for the previous 14 days, and it is trending slightly upward. We often are asked, so what about that UK variant? Do we have any cases of those? And yes, we do have 2 in Flagler, but it has not increased. That number 2 has been the same for the last 4 weeks, and then Volusia has 5. So that's all the data I'd like to share. Now I'd like to transition into a discussion about vaccinations. So in the state of Florida, 3,895 people have been vaccinated so far. And then in our county, here's the Flagler County summary for vaccinations as of March the 11th. Total people vaccinated, 28,179. And you can see the breakdown between first dose and second. We are providing the Moderna vaccine primarily here in Flagler County. We did receive 800 doses, as I said earlier, of the J&J, Johnson & Johnson vaccine, but we were asked by DOH, state, and Department of Emergency Management to hold on to those vaccines for the education, teacher, and school district staff clinic that we are doing this coming Saturday at FPC High School. So we're holding on to the J&J for our teachers and our staff of the school district. So 28,179 so far in Flagler. So I want to share with you some good news, and that is that out of all the 67 counties in the state of Florida, we are ranked 7th in terms of percent of population vaccinated. It has a lot to do with the fact that we have a lot of seniors here. And then when we talk about seniors, 65% of our seniors have been vaccinated so far in Flagler County. So we're real proud of that statistic, and we just want to see it get higher and higher. So this shows the racial breakout of our population here. 83% of the folks in Flagler County are white, almost 11% African American, and then other ethnicity groups, 5.32%. And you'll see why I wanted to share that, because when you break out the number of people vaccinated in Flagler County, if we could just shoot our eyes down here, 1,631 African Americans, people of color, have been vaccinated of that 28,179. So how does that compare to African American percent of population? African Americans represent almost 11% of total population, and of the percentage vaccinated of the 28,000 so far, they represent 5.7%. Now, 2 weeks ago, when I spoke before the NAACP, it was only 4.3%. So we are making strides already. We've been at the Carver Community Center and Gym the last 2 Fridays. So we really have begun to make a push to get our folks vaccinated. And so that's why we believe that 4.3 has increased already in 2 weeks to 5.7%. So we are in week 12 of giving out vaccines. The majority of the vaccines, which is the Moderna, and again, I mentioned the 800 doses we have in storage right now of the J&J. The health department has received 13,500 doses so far. We've given most of them out at the fairgrounds off of Route 1. And then we've done a couple little small vaccine clinics here and there. And we're getting within 5 days of receipt of the vaccine, we are reaching 99%, getting it into arms immediately. There is no holding on to these vaccines when it comes to our health department. 64%, I said 65, sorry, 64% of our Flagler residents over the age of 65 have been vaccinated, either at the fairgrounds, either as people who are homebound. We've done teachers already over the age of 65. Publics have vaccinated a few, and people can get their shots at different counties, like many of you have. Same token, we've given shots in Flagler County at the fairgrounds at people from Orlando, West Palm Beach, Putnam County, St. John's. You can go anywhere where you feel comfortable in getting an appointment, or how quickly you get an appointment. Advent Health Palm Coast, the hospital, they've given out 2,200. Publix has received 3,187. 87% of that number has gone into arms. And then CVS last week received 300 doses from a federal pharmacy program. And I don't know what the status is of how many have gotten their shots from CVS. So these numbers total 19,187. So what it does not include, it doesn't include all the doses that we have given to residents of any long-term care facility. And we know that all residents of long-term care facilities or group homes or small adult care homes in Flagler, everyone has received who wanted it their first dose, and the majority have received their second doses. Nor does it include residents from other counties. So the difference between the 28,000 and the 19,000 here includes this group and residents from other counties. All right, current mass vaccination operation. I mentioned the fairgrounds. We can do 1,000 a day. Every Monday and Tuesday are second dose days, because keep in mind, for the Moderna, 4 weeks after you get your first dose, you need to get your booster shot. So we do that on Mondays and Tuesdays. Every Wednesday through Friday, we can provide up to 700 plus first doses somewhere between this time frame. We're getting better and better. Wednesday of this week, yesterday, gosh, we did 771 doses by 1 o'clock in the afternoon. So we're getting better and better and faster. So we're getting 1,600 new first doses a week versus 800 when we started. So that's good news. Plus we got the 800 Johnson & Johnson. So I'm going to quote my boss, who is the state surgeon general. Dr. Rifke said, "You are going to be swimming in vaccines by the end of April." So we're getting geared up for the future. So it takes about 50 people of staff, paid staff, and volunteers to get all these shots in arms on a daily basis. So I want to make sure you had this slide. In order to register to get an appointment for a vaccine in any county, people can get online to myvaccine.fl.gov or call this number right here to get an appointment. All right, what's the future? The future is we want to be at various locations around the county. We want to be at a couple of locations each day. And if you can scan on down to this bullet right here, sites so far that we have made arrangements for to vaccinate in March is Mount Calvary Church, Mother Ann Seton, United Methodist of Bunnell. We were at United Methodist, our first church, not doing testing, but doing vaccinations. We were there this past Saturday. Parkview. I would love to do a clinic, and I've shared this with your leadership at the AACS, at your beautiful, inside your beautiful building. And
add another A to that.
Was that? Oh, add another A. Sorry about that. And then the Carver Gym. We were at the Carver Gym 2 Fridays in a row and did about 200 people each day. Half the people were of color, and many of the folks were feeble, were in wheelchairs, had walkers. You knew that they had a transportation issue. I want to mention our beautiful volunteers real quick. We're working with Flagler Volunteer Services, and we could not pull this off without all the wonderful help that we're receiving. So all pharmacies around the country will be engaged. Right now, only 4 Publix so far in Flagler have doses, and I shared that slide with you moments ago, and then 1 CVS, and then the federal government. They're contracting with Walmart's, Targets, and Winn-Dixie's around the country. None here yet, but around the country. I'm going to be making arrangements to get our smaller pharmacies doses. For example, Flagler Beach Pharmacy, Grace Community. We're going to give them 300 doses tomorrow. And then another pharmacy contacted us today. And then I mentioned we'll be at the FPC gym on March 20th and this coming Saturday. Vaccine hesitancy. Dr. Bickel and I have talked about this. We have researched this, and we know that this topic is a sensitive one. We know that there's mistrust in government. We know about the healthcare disparities, whether it's outcomes, whether it's vaccination opportunities, the memory of public health scandals that I know you've read about, the Tuskegee study and the Henrietta Lacks case, just horrible. And so we're aware of these, this disparity in outcomes and access and misinformation on top of it about vaccines. And so we are here with you to address that. We acknowledge it, we know it's there, but we want to address it head on because African Americans, they are more likely to test positive, 2.9 times more likely to be hospitalized and succumb to the disease. So this is extremely important to us. So here are the things this is what we want to do. This is the plan of action that Dr. Bickel and I have talked about with my team. You know, we want to share the truth. We want to collaborate, engage, build trust. You know, we're a safety net already for minority groups. We don't have a birthing hospital here in our community, And so our nurse midwifery program for those moms who are either women of color or Medicaid moms, or they don't have insurance, anyone, it doesn't matter who you are, we are there for you. Joe had mentioned, he knows that African-American scientists and leaders participated as part of the FDA committee to give these products their emergency use authorization. The clinical safety and efficacy of these vaccines, this has been proven, and it's been, ongoing since this thing started in March. And out of 1 million doses, only a handful do we have documentation of side effects. And there are some good studies on that already. And then the collaboration, again, a good example is our presence at the Carver Gym these last 2 Fridays, and reaching out to our African-American churches like United Methodist and Bunnell, and then reaching out to you and NAACP. I met a gentleman, he is the chair of the minority group caucus for Flagler County. So we're gonna make contact with him also. Okay, 2 more slides left for me. I want to make sure you knew of the governor's executive order that came out this week. It basically expanded the number of people who are eligible for getting the vaccine. Of course, you all know long-term care facility residents, they're number 1. What he did was he reduced the age from 65 to 60, and that is effective March 15th. Again, all healthcare personnel, we want to vaccinate you. We had a special vaccination clinic on January 2nd at the fairgrounds. It was our first big one, and it was for healthcare personnel, the people who take care of us. They need to be safe and healthy. The governor said any teacher, right, or staff member of a school district who's over the age of 50 can be vaccinated, and we're working on them. We already started, but we'll be doing that this Saturday and the following Saturday. And then, of course, law enforcement and firefighters over 50, we've already taken care of many of them. And then this big category, any person who a physician deems as being extremely vulnerable to getting COVID-19. So that would be individuals with comorbidities such as diabetes, chronic conditions like hypertension, COPD, CHF, someone who's immunocompromised, maybe lupus would be an example, or is a cancer patient. These are individuals who are vulnerable, and they, no matter what your age, we want to get these folks vaccinated. So what they need to do is get a special form to be filled out by their doctor who they have a relationship with, and that is all that's needed in order to get the shot and make an appointment. I also wanted to mention the new CDC guidelines that people who are fully vaccinated, so many of you on this call have gotten or are about to get your second shot. All right, within 2 weeks, you should be all set to go. And so here's what the CDC says. If you're fully vaccinated, you can visit other fully vaccinated people indoors without wearing a mask. When you visit unvaccinated people from a single household who are low risk for COVID, you can get away without wearing a mask or physical distancing. If you are fully vaccinated, you can refrain from quarantine and testing following a known exposure if you are asymptomatic versus being symptomatic. But still, when we're out in the public, we want to make sure that we still continue to wear masks, maintain physical distancing when visiting unvaccinated people who are at high risk for COVID, or you're out and about in public. It's still very important to follow public health guidelines in order to not transmit the virus, because there's a lot more that we need to learn about COVID-19. It's a novel virus, and it's called novel virus, meaning new for a reason. We're learning about it each and every day and week. So I wanted to share those new guidelines, especially for you that have grandchildren. I know you've been wanting to hug your grandchildren for quite a while. Well, I'm so glad that the CDC began putting out this guidance this week. So that is the end of my presentation. Now I turn it over to our medical director, Dr. Stephen Bickel, and we will be available to answer your questions when he is done. Thank you all for your attention.
Thank you, Bob, for your fine work here. We really appreciate it, and we'll look forward to working with you further.
Absolutely, you know it. Take it away, Dr. B.
So what I want to do in the next few minutes is kind of go through 5 things. Daily cases since last year. So this is basically about a year's worth of data. And what you'll see is that, even though there's a lot of commotion, last spring, the cases were really pretty low. And then in the summer, we had that second wave and they were, more. And then, what would happen the fall and winter was just, way more than anything before. This is deaths. They kind of parallel cases, except you'll see a few things a little different. One is that we had a lot more deaths in the beginning relative to the number of cases than we did later. Part of that was kind of hit us by surprise. Some areas like the Northeast were overwhelmed. We're gotten better at treating people. Also, fewer elderly got sick as the time went on. So, the younger people had less hospitalizations. But you'll see that, the last, what we kind of got used to in the last year was just nothing compared to what happened this fall and winter. This is Florida. It's a little different than the US because you'll see we had a much bigger second wave, that middle hump in the summer. Next slide. That was cases. This is deaths, and you can see that the deaths were really pretty high for, relatively speaking, in the summer, and then they're still pretty high now. The deaths tend to lag cases because it takes a while for people to die once they get sick. So that's just kind of obvious. So even though the cases have come down a lot in Florida, the deaths are kind of lagging. We think they're going to start coming down a lot, partly because of the vaccines and partly just the seasonal wave that we're going through. But you can see that the numbers are coming down. And this is just, Bob already showed you this slide, a little bit disturbing that we're actually going up in cases the last month, those last 4 bars going the wrong direction. This is a projection that was from a month ago of where the line is one line, that's where we are, and then where the lines diverge into the 4 different lines, those are different scenarios. Like if people wore masks all the time, that bottom green line is how much cases would go down, even though all these anti-maskers think they don't work. The models show the masks really work quite well. And then the red line, that top line, is like what worst case scenario if the variants were bad and people just stopped, protecting themselves. And then this is the infection slide moved forward a month, and you'll see that it's a lot lower. And those 3 different lines that come out are all lower, meaning that the caseload has gotten so much better that even if people stop doing social distancing as much, it won't be as bad. So we're in a much better place than we were a month ago. And I'll go through the next 2 slides quickly. These are deaths. They kind of parallel the cases. And next slide is a month later with deaths, and you'll see it's a lot lower. The curve came down a lot. And so what we're looking at over the next few months is a lot better than it was a month ago. The question is that from the vaccines? Probably a little too early for the vaccines to have a big effect on that, because we're only talking about getting about 20% of the population with 1 dose of vaccine so far, not even. Whereas, so it's a little different scenario. But the thing that the vaccines have really impacted is the hospitalizations and deaths, because as we'll see in a second, the people who are getting vaccinated are the most vulnerable people by design. And so that's where the hospitalizations and deaths are coming from, and have been for the last year. So how does COVID spread? You kind of know about this, but it's changed a little. It's basically a product of humans interacting with other humans, spread from person to person. It's mostly through the air. Droplets mean they're little particles of virus with some water sort of vapor in them. And depending on if they're dispersed, they can travel long distances. Mostly they travel like 3 to 6 feet, and then they hit the ground. So that's why this idea with social distancing, that you're farther away from people, those droplets hit the ground before they land on you. And the risk factors are the number of people gathered together, closed spaces, things that increase transmission, like singing, talking loudly. And it's seasonal to some degree, and that's just because with humidity, the droplets fall to the ground faster.
And so they die when they fall to the ground?
They don't die, they just sit on the ground, so they don't get on you. Mostly it's sort of them getting propelled and then landing on you, and then either landing on your face, getting in that way, or you touch your face and kind of get it into your mouth. So it's mostly just they fall to the ground more quickly. The other thing that there was a lot of emphasis in the beginning was on surface spread, that they'd be on different surfaces and people would get it that way. And we've really been de-emphasizing that because it just hasn't panned out that from the studies that were done, that was a big factor. And the other thing that's been found is that outside transmission for a variety of reasons is much less than inside transmission, way less, maybe by a factor of 20 to 1. So we've been encouraging people to be outside. We've been less strict on recommendations for for social distancing and mask wearing when you're outside. So this slide is about who spreads COVID, and you'll see that the two groups that have the darkest color there are the 20 to 34 and 35 to 49-year-old groups, and they're responsible for spreading about 3/4 of this population spread, even though they're only about 40% of the population. And that's for a variety of reasons. When they get sick, they're not in bed, they have milder symptoms, they tend to be more active out in the community, working, and things where they're in contact with people. And to some degree, unfortunately, they're less vigilant about the social distancing practices, partially because they feel less vulnerable. This is who gets COVID, who gets impacted the most by COVID. And all of us seniors know who they are. The statistics in Flagler County are about 21.6% of the population over 65 gets COVID of the whole number of cases. So that means those numbers mean is there have been 1,192 cases in the over 65 group, and there have been 5,517 cases in the total population. So that means that group is responsible for 21.6% of our entire caseload. But if you look at hospitalizations, you'll see of the 313 hospitalizations in the county, 201 of them were in the over 65 group. So that's 64%. So 3 times as many were hospitalized as were infected. And then if you go to deaths, it's over 90%. So the over 65 group is the ones who suffer from COVID, even though they're not the ones mostly spreading it. So I want to talk, herd immunity is kind of a tricky, some people find this concept easy to understand, some people don't, but basically you can look at it this way. There's this statistic we use called the R factor, or the reproduction coefficient. And what it means is if one person has COVID, how many people are they going to spread it to on average? And if it's one person spreads it to one person, what that means is the disease will not expand in the population. It may go a while, but the numbers, it'll be 100 one week and 100 the next week and 100 the week after. But if one person can spread it to more than one person, like let's say 3 people, then the first cycle, there's let's say 100 cases in the community. The next cycle there's 300. Then the cycle after that there's 3 times 300, so that's 900. And you can see how we can go from a small number of cases to thousands, even millions in the course of a couple months with this expansion. So what it means is that we need 60% of the population to be immune to COVID to keep that spread down where it actually doesn't grow. And then that's the level they call it herd immunity. But what actually happens is it's not like a fixed number where once you hit it, the society's population is protected, and before that they're not. It's that it's gradual. The more people are vaccinated, the more the numbers start coming down. So we get a benefit even before we hit herd immunity, even if we never get to it. Well, it'll make it the spread much lower. But what we're hoping is that we get way even beyond this 60%, because what that can do is it create a situation in our county where it just doesn't spread very much, and then that protects everybody. And that's kind of the concept of herd immunity, that you can benefit from herd immunity if the spread goes down, even if you yourself are not immune to the virus. So people have asked, I've gotten a couple questions from your group on these vaccines. Basically, what you need to think about is the way the immune system works is that it recognizes foreign invaders by their shapes. So we have on our cells little projections that are different for our cells than for viruses or for bacteria. It's like you're being invaded by a foreign army, and they would have different uniforms. And that's maybe how you find out that you can tell they're different, that these viruses have their own little shapes, and the immune system recognizes that and then targets it. So the way to think about these immune responses is, if you're being invaded, you have a certain amount of time to respond. That could be an army that's invading your territory. It could be a virus that's trying to get into your body. And once it invades, it starts multiplying at an extremely rapid rate. And you're in a race for time when that happens. So what you're trying to do is you have to recognize that you got some invasion going on. Your antibodies have to, the cells that make antibodies have to get mobilized. They have to recognize what's invading. They have to mold themselves to these shapes of these particles, and then create antibodies that will take these particles out of circulation. And that takes time. It takes like a week or so. And while it's doing that, the virus is multiplying like crazy. So what tends to happen if you look at these, the course of illness and the viral levels in people, is that the virus levels peak about 7 days after you got exposed to the infection. And by then the virus levels start coming down, and that's because your antibodies are taking them out of circulation. Well, the way that, and anyway, the problem with that is just how much time it takes, how many viruses there are by then, and how much destruction's taken place in that time period. What vaccines do is they pre-program you. They introduce this material that gets your immune system revved up to make antibodies to these proteins. And then after the vaccine has done its work, there are cells in the body that remember that. They call them memory B cells. So they're not making giant amounts of antibody after the first couple weeks, but the antibody they did make sticks around a long time. But the cells are there ready to go if you get infected. And so instead of taking like a week to maximize their activity, they can do it in like 2 days. So before the virus has a high level in your body, it's already getting attacked. And that's why people, when they get these infections, get exposed after they're vaccinated, they wipe the thing out. Even they may not have it. Usually they have no symptoms, or if they do, they're minimal symptoms. And that's just because they got going on this in 2 days rather than 7, let's say. So the remarkable thing is, even though there's a number of people out there who think vaccines are unnatural and all this stuff, it is one of the most natural medical therapies you could imagine, because you're really just doing what the body would do already. You're just introducing these virus particles before the virus comes on its own. So it's not like a foreign medication or a chemical that can interact with the body in some way. You're just using the body's own immune system doing what it would do on its own. Next slide, please. So this is just kind of going through, how do we stand with herd immunity? There are about 30 million cases so far in the US that have been diagnosed. The estimate is that the actual number is 3 to 4 times that, which would be 90 to 120 million cases. And then about 60 million people in the US have been vaccinated. And let's assume that they're all to some degree immune, even though it takes 2 doses for long-lasting immunity. And then say there's a little bit of overlap. Let's say 20% of the people who've gotten COVID have been vaccinated. So you subtract them out. So I came up with, we may have as many as 144 million of our 330 million population that has pretty decent immunity to COVID, which is about 44%. So if herd immunity is 2/3, and it might, I said before, it might be 60%, it might be 2/3. 44% is 2/3 of 66%. So we might be fairly far along towards herd immunity, which makes it even more exciting to push this to get there, because it might be sooner than we think. Next slide. This is just the different vaccines. AstraZeneca is not available in the US at this time. It's available in different parts of the world. Novavax will probably be coming to the US sometime this spring. And then Moderna, Pfizer, and J&J are here. J&J is a 1-shot vaccine. They're studying 2 shots. The numbers look like it's not quite as effective in preventing disease, mild to moderate disease, but it is very effective in preventing severe disease, which means being in the hospital, which is what we mostly care about. And it also was studied in an era, like 3-4 months later, when there were more variants in different parts of the world. So it might be a tougher comparison. Most experts think it's a pretty darn good vaccine. Moderna and Pfizer set the bar really high. Normally, we're pretty happy with a 70% effective vaccine and 90% effective preventing severe disease. But compared to those 95 numbers, that's a hard hurdle to beat. So it looks like all vaccines are good. There's some advantages to the J&J. It's easier to store, it's easier to deliver, it's 1 shot. It might be suitable for rural areas, smaller pharmacies, doctors' offices, where less, the health department has to go through they're really good at storing these vaccines and using them, but you have to know what you're doing with those because of the storage requirements. With the J&J, you can just put them in the refrigerator for a month and they're okay and use them as you need them. So there's some real advantages in terms of getting this out in the community with the J&J. Younger people, you're not quite as worried about smaller differences in protection, might be good for them. Then they don't have to worry about getting the 2nd shot. So it looks like it's going to be a very useful, addition to our toolkit. And we don't really need any more vaccines besides these 3, although I think, Novavax is going to make it in the US. So we're, like Bob said, we will be swimming in vaccines in the next month or 2. We'll be begging people to get vaccinated. Next slide. Kind of went through that. Safety. There's a very good question about how does FDA approval differ from emergency use authorization? Were these vaccines rushed? They were rushed, but not that rush doesn't mean shortcuts were taken. That just means they were moving very quickly. And that was because a lot of money was poured into this. So a lot of staffing to do these studies. Normally with drug studies like pharmaceuticals, chemical drugs, the studies are often like a few hundred people, sometimes a few thousand people. These vaccines were all tested in tens of thousands of patients, big numbers. And the reason for that was because you're looking at what they do to prevent infection. So if the infection rate is only like 2%, then you need 20,000 people to get 400 cases to see if the vaccine prevents 80% of them. So you needed those numbers just to see if you got the right statistics to show that they worked. That was part of it. But they also got a lot of safety data out of that. And the vast majority of reactions to vaccines happen within 2 months, like 99% of them. There are some rare delayed reactions, some immune reactions, Guillain-Barré is one of them, but that's like a 1 in a million proposition. Hasn't actually shown up for these yet, so it may not. But it's happened a few times with vaccines in the past. It's not something that's being dismissed, but so far the safety data are really looking good. I mean, surprisingly good. And that doesn't mean it can't be an issue, but when we're talking about potentially preventing thousands of deaths a day, the idea that you might have a 1 in a million reaction, you got to put that in perspective. This talks about severe reactions. These vaccines trigger a pretty decent reaction. Less so in older people. I mean, I wanted a bigger reaction than I got. My arm was a little, to show that my immune system was really pumped up, but my arm was a little sore. I had a little bit of achiness, but that was about it. And most of my cohort of people like 65 and over had the same thing, just very minimal. Although we had one person who was felt like he had a cold for a couple of days. But younger people have this more. Second dose have it more. There are some severe allergic reactions. You can have anaphylaxis where you get swelling in your mouth and throat, but potentially life-threatening. Nobody's died from this. We're aware of it. That's why we observe people for 15 to 30 minutes after their shots. But the rate is pretty low. It's been estimated like somewhere between 1 in 200 to 500,000 people get a reaction of this severity. So it's pretty rare. One of the studies suggested that Bell's palsy might be more frequent in one of the vaccine groups. Turned out with more data that has not panned out. There was a thrombocytopenia means a low platelet count. That didn't pan out. A number of people have died after vaccination, but there's no evidence that any of them died from the vaccination. When you vaccinate, a lot of 80-year-olds, millions of them, some people die, and so there's been some of that. But the other thing people should know is I actually spent about 20 minutes trying to find the exact difference between the criteria you need to get FDA approval versus emergency use authorization, and I couldn't find it. The reason is it's pretty subtle. There's the criteria for emergency use authorization is not as exacting as for FDA approval, because you're in the middle of an emergency situation, which is why you're doing the approval faster, because there's a lot at stake, public health emergency. But there's these vaccines would have met the hurdle for effectiveness no matter what. I mean, it's just the safety data goes out a little longer with the FDA approval process, and also they want to look at like how long the antibodies from the virus and the protection lasts. So we don't have that data yet because we're just like 4 months into vaccinating people. So that will come. There's a lot of surveillance going on. The federal government has a surveillance program. It's called VAERS, V-A-E-R-S, to look at it. There's a specific one they set up for COVID. I imagine a number of you have been getting text messages about how you're doing and all that stuff. That's to gather data, and they're doing it on millions of people. So the idea of that is they find 5 cases of X or Y happening, then they're going to look at it more carefully, like some of these rare diseases. So it's being looked at very carefully. Public trust in vaccines is very important for our public health system, and the scientists involved in this stuff take it very seriously. Next slide. I think I'm kind of done. I think, where are we going to, I've kind of covered a lot of this. Where are we going from here? Hopefully we're going to herd immunity, and herd immunity can be Flagler County. It doesn't have to be Florida. It doesn't have to be the U.S. because it doesn't mean you can't get people move down here or come down for a visit from New York and they spread it in a little local group, that you can't get it from somewhere else. But, if 80% of the people in Flagler County are immune from combination of vaccination or being infected, and we keep urging people, it's better to get immune from vaccinating than from being infected. Then that could mean that we pretty much get back to normal with our daily lives and not have to, we can start putting this in the rearview mirror. So it's really, and that's even true for micro communities within Flagler County. So it's even another kind of, goal or reward for communities, smaller communities to get all their people vaccinated, to just protect each other. So that's where we hope we're going. There was this question about variants. What role are they going to play? We don't really care that much if variants spread faster, because that may make the case number go up. We care because it could cause deaths and hospitalizations in the short term, but it's not a long-term problem if there's remain susceptible to the immunity, to either natural immunity or vaccine immunity. And this may seem surprising to people, but it's a common observation with vaccines is that because these vaccines are engineered to hyperstimulate the immune system, or they produce a immunity that's longer and stronger than normal infection. So especially against the variants, that they are likely to protect people even more. It's another reason to get vaccinated. It's also the reason that we recommend people who've had COVID get vaccinated, because it produces a higher level of protection. So that's a pretty big deal, and it may turn out to be our biggest, our most important weapon against this long term. And the other thing is, with this messenger RNA technology, you can make new proteins. Like if these variants have different shapes of their spike proteins, you can make vaccines that will target the new ones. So there might be a booster that comes out like in the fall or next year that's designed to keep the immune system revved up, but also designed to create antibodies for these variants to give longer and broader protection to people. So that's it. I think we welcome questions. Hope we didn't pound this into the ground here. And we appreciate your interest in this whole area and your partnership in promoting this to your community. Because as leaders of your community, you're more important in getting people vaccinating. I mean, we'll do the vaccinating, but you're the thought leaders that will help people want to be vaccinated.
Well, we thank you, Dr. Bickel, for all that you're doing to help us towards that end. And we, as I said, at AACS, and as our president, Joe Matthews, has reiterated, we are determined to provide the information so that people can feel free to make an informed decision for themselves. Mm-hmm. And now I'd like to open it up to others who may have questions.
It's just an offer of assistance. You've mentioned your communications person more than once, and Linda and we've mentioned Linda Matthews and myself. We are we have the local chapter of the National Black Nurses Association, and yes, they have a lot of literature that we would be willing to meet with her and adapt that so that it is relevant to our community.
That would be great, Alma. We can arrange that. Her name is Gretchen Smith. So I have your contact information, and we'll arrange that. You bet.
Well, Gretchen, we would love to. I mean, because National Black Nurses has been doing this all over the country.
Oh, and good.
We can take the information that they have, promotional information that they've already built, and make it relevant for our community.
I know that there are other folks out there that may have questions. Can we call on someone else or open for someone else? Sonia White, if you're with us.
My question is, and I've been reading quite a few articles about the efficacy of some of these vaccines, especially Johnson & Johnson. My question is, my concern is, are they choosing population where they're going to be giving out the Johnson & Johnson population? Because from what I understand from Dr. Snyder, where he said that the Johnson & Johnson will be distributed in areas where it's like rural areas, maybe where it's a much larger Black population. Are they politicizing or making this a racial things when they're giving out different vaccine versus Moderna and Pfizer? Because the Moderna and Pfizer vaccine, the efficacy rate on that one is 97%, where Johnson & Johnson is only 76%. Now, if a person is vaccinated with the Johnson & Johnson vaccine, and you're stating that they will get sick if they do in other words, their body is not generating that immune system as far as the Moderna and the Pfizer vaccine to protect them.
Let me, I'm going to answer like 25% of the question. I'm going to ask Dr. Bickel to chime in for the rest.
Okay.
So regarding the 3 vaccines, Moderna and Pfizer are way ahead of the game in terms of supply of inventory for the state of Florida and our residents in our counties. The J&J vaccine, the amount produced so far has been minimal. And we expect that for the next few weeks to continue, but they're going to catch up eventually. I've received no guidance from DOH or from DEM about any association between, okay, you saved this vaccine for this population group or this minority group or this rural community. There's talk of that, but no decisions have been made. The only decision I'm aware of is that they asked us of our 800 J&J, Johnson & Johnson, is hold on to that. Don't use it for the fairgrounds. Don't use it for the general population. Please hold on to that for the education mission for teachers and staff of school district members. So that's all I know at the moment, and I will keep you informed. But yeah, there is talk of, the rural communities, but no decisions have been made in Florida yet. And when a decision is made, let me tell you who the decision maker is about who gets what. It's the Governor DeSantis. Period.
That is the concern of the majority of the large Black population. That is the big concern.
So Steve, this topic of efficacy and J&J is really, really important. So do you want to address it?
Sure. First of all, it may not turn out that there's that much difference between the vaccines. They're still gathering data. They were studied in different populations. The J&J was studied in Brazil and South Africa, where the variants are most widespread, in addition to the US, although the US numbers were different, were lower too. It was just the 1 dose studied versus the 2. J&J's looking at a 2-dose version, which will probably be, have data on in the next couple months, maybe sooner. So it may just turn out, with all those things factored in, that it's not that different. The other thing is that in terms of preventing severe disease, it looks pretty similar. So what we're talking about is people who would have like a cold or even a bad cold, but never need to be hospitalized. So that's still a pretty good result. The other thing is that, but that's going to be something we don't know yet. The second thing is, there is not going to be, as far as I know, any sort of, as the vaccines become widely available, I think everybody's going to have a choice of any of the vaccines. So it's going to be mostly where they're going to get vaccinated. The idea that, there might be a slightly less effective vaccine in a small pharmacy. Well, that would be compared to no vaccine available in that pharmacy. So people will always have the option, like in Flagler County, of going to the health department sites if they want. So we're mostly trying to focus on getting that extra 10 or 20% of the population that might not get vaccinated at all to get vaccinated. But this is going to be, there are going to be a lot of people looking at this. And I think there's going to be people be going out of their way to not discriminate. And I think, to me, I wish that we cared more about healthcare disparities in general,
Right.
not just with COVID.
Absolutely.
To me, it's, I think in COVID, it's going to be pretty, pretty fair and equitable. And the rest of our healthcare system, it's not. So to me, that's kind of one of my pet peeves. But I think it's, I think what we're sort of focusing on is it's going to be voluntary. I mean, if people want to get Moderna or Pfizer, they're going to be able to get Moderna and Pfizer. They may just have to drive 50 miles. And if it's a community where maybe, they don't have cars or they don't like to travel or whatever, it'd be nice to have one down the street so that they get one instead of not getting one. So I think it's going to be a lot of stuff at play in the next 6 months. What we're hoping is that we continue to look at this, as a community, that we scrutinize this, that we make sure it is fair, that we make sure we're hitting all segments of the population, and that this becomes a real success story for every community within our, our county and our state. So that's kind of our focus. That's why we're doing these events, is because we need leaders in each community to spread the word and to help build trust. Because there are reasons why there's not a lot of trust right now.
Right. Let me ask you this, Dr. Bickel. Is there the ability to have pop-up vaccination sites in rural areas, such as with the buses that we see that collect plasma or blood donations? Can those vehicles be pressed into service?
Is that we want to reach out in the community. We want to make these public events that we're sort of proud of. This is public health in action, and we need more public health in this country, and we're certainly, I think you guys appreciate that, and that we're ready. We're excited about this.
Yeah, we are.
Okay. Other questions out there, Marie McCray, or are there other folks?
Yeah.
Yes, my question is, I hear that if you've had the virus, that there is a waiting period before you can get the vaccine. Is there any truth to that?
A little. There's a little truth to that. You're not supposed to get it when you're still sick. So like for 14, 21 days since you started having symptoms, until that time, you're not supposed to get it. And in general, we don't want to give the vaccine to somebody who's acutely ill in general. If they have a chronic illness that's stable, that's fine. But so that would be true for any pneumonia or illness. Then there's this question of like, do you need to wait? The 90 days has been thrown out there. 90 days is the amount of time you need to wait if you were given convalescent plasma or monoclonal antibodies to treat your COVID infection. And the reason for that is if you have active antibodies in your system, they would block your body responding to this immune stimulant. Regular COVID infection and weren't treated that way, you could be vaccinated anytime after a few weeks. Your risk of getting COVID in the first 90 days is pretty low. After that, you're more likely. So it's not like it's high urgency to get vaccinated that first month or two after. But my favorite COVID doctor who I listen to, he does reports every week from New York, said never pass up an opportunity to get vaccinated. Right. So I would. There is one other issue, and that is people who've been vaccinated, who've had COVID, may eventually not need to get 2 doses, but for now they do. That's being debated. They get a pretty strong reaction to the first dose. That's kind of like what most people get to their second dose, but they're still recommending 2 doses. But that may change as there are more studies. But so basically, we're recommending it anytime after if you have an opportunity after you've been, recovered.
Another question?
Yes.
Can out-of-state people get vaccinated in Florida?
No, ma'am. No, Marie. Nope.
No.
People who live in Florida and live in one of the 67 counties can get vaccinated from one county to another. I gave that example of us at the fairgrounds. We have about 7 or 8 counties that come to us regularly, residents from those counties, as far away as Orange and Palm Beach County. But in terms of other people from other states, no, we are to turn them away. They are to go to their own state. It's particularly a problem, Marie, in the Panhandle area, with Florida being so close to Alabama, Louisiana, and other states.
Well, I thought I had read something or heard something where we had all these people coming,
We are not a tourism vaccination destination. The governor has really come down hard on that. I would really get my hand slapped if I knowingly knew that someone snuck in from another state. That's why people need to show, if someone produces a license that is from another state, or we see a license plate from another state, we are obligated to ask them, do you live in Florida part-time? So the definition of that is you need to show evidence, whether it's a rental agreement or a mortgage payment or something, that you are a resident of Florida for at least 30 days. If that occurs, you are considered to be a part-time resident of Florida, and we can give you a shot.
We have such a high percentage of snowbirds that spend a significant amount of time with us, or family members that routinely come for a month or 6 weeks.
Yep.
Are those people eligible?
They are, but they got to show proof that they're here for at least 30 days. They got to show something, a utility bill, rental, rent payment statement, or something.
Okay, I thank you. That's Joe Jones, our first vice president here at AACS.
Hi, Joe.
Hello. There is a perception that vaccines are effective by giving the person vaccinated a small portion of the disease that makes the vaccine work. I've read over and over that there is none of the COVID in the COVID vaccine. Is that perception correct? First of all, is the perception correct that vaccines are created that way? And if they are created that way, why was COVID created without doing that?
Dr. Bickel.
Yeah, sure. Well, there are some vaccines that are called live attenuated, where there actually are the virus, can replicate. It's been doctored so that it doesn't produce a severe infection. There's one flu vaccine like that. There's some others. And what happens with these vaccine development is there's a lot of science that goes into it, and it's kind of hit or miss. You never know until you do the studies exactly if it's going to work. You might, in the cells, it might look like it's going to work, and in the body it doesn't. So they kind of go with whatever one they can get to that works. If it has to be a live attenuated, they will, even though it's not generally your first choice. But with COVID, what's happened is it's coincided with this explosion of research advancement in molecular biology and how the various particles are made, and like they were able to identify the gene sequence of the virus within a week, and then they figured out the spike protein, and then they could make it within a month. So that's stuff we couldn't do 10 years ago. And so because they got so good at it, they didn't need to use one of these techniques that use the virus. Now there are some vaccines, some COVID vaccines, not in the US, but in the world, that are being developed that are called inactivated virus, where they actually took the virus and treated it so it couldn't, they gave it a treatment that damages their DNA so they can't replicate. And that's the form of that, that I call that fourth category. That's none of the viruses and none of the vaccines in the US, but there will be some. But those are inactivated. I don't think anybody would want to mess around with live COVID vaccine, even attenuated these days. It's just too nasty. So
Okay.
we didn't have to, because this other technology was so effective. I mean, really 95% kind of shocked a lot of us. We were hoping 70, 75, but it's because they got this protein so well developed that the immune response was very robust to it. So I hope that answers your question.
Yes.
Thank you. And thank you, Joe, for asking that question. We're going to start to wrap up this session. So I'm going to be asking for any last questions that we have. And I'm going to go to Irv Robinson. Dr. Robinson, what say you?
I just wanted to add to what Dr. Bickel had said. Where we are in the United States today is hopefully to be leading in the science related to bioengineering, such that going forward, not only is this virus going to be in the dust, so to speak, but some of the diseases that we've been under the gun for a long period of time, they're going to be altered. And the treatment that we're going to provide going forward is going to be based on this bioengineering to a large extent. We can go into bacteria, we can go into viruses, we can alter them, we can take out the infectious parts and neutralize them. And so the thinking for everybody now has to leave where it was when the Salk vaccine was present for polio and where the flu vaccine was that we're still using. And be aware that our scientists have really been on the cutting edge of making a difference, not only for this virus, but for diseases going forward. And I just wanted to get that point out. The other question that I had is there any evidence of the South African variant, the B1351 in Florida so far? I know we mentioned that the UK virus, the 117, has been documented in Florida, but has there been any evidence of the South African variant thus far?
There are a few cases.
Are there?
There's actually a fair amount of the UK in Florida,
Yeah.
but just a few cases of South African. You know, our surveillance is getting ramped up, so we may not know how many there are fully. But there are a few cases, but so far we haven't found a lot.
That's why I asked.
By the way, I totally agree, and I thought you very well stated what you're talking about with the future of bioengineering for us.
Mm-hmm.
But what occurs to me is that with all the advancements being made in science and all that Dr. Robinson just said, the challenge for us will still be to convince people to take these vaccines.
Yes.
Yeah.
That will exist, and as we move forward, it will only intensify.
Right.
So I can well imagine that the kind of discussion that we're having today, the forum that we're having today, will be necessary going forward. And we are committed to doing that and to trying to bring information to people so they can make informed decisions.
We are going to need your help with all of that. Yes, indeed.
And we're committed to that, Joe Matthews and our board of directors and our executive board. We're committed to doing that. And we will be meeting with you on subsequent Thursdays of every month and entertaining questions from more of our membership and more of the committee. I want to thank you, Bob Snyder, for being with us today, and Dr. Bickel for your fine work. And we're with you in this fight. We very much are.
Great. Thank you so much.
We really
Thank you.
appreciate your partnership.
Thank you.
Thank you. And thanks
Okay,
for
thanks,
everyone
folks.
who turned out. We expect to hear more questions from you. I need your feedback moving forward. Thanks, and have a great evening, and stay safe.